Hi everybody. Today I thought I might try a little experiment. I know that people are often writing on the ICA Facebook page about catheterizing either in the doctor's office or self-catheterizing at home. So I thought I'd try and share with you what I've learned about being catheterized either in the doctor's office or at home. I have to self-catheterize daily due to severe retention issues. And so I've been doing this for years now and feel like I've kind of become a bit of an expert. I'm kind of lucky I have a mother who's a retired registered nurse who was also able to reinforce what the doctor's office taught me about how to do this at home if I had problems. But I thought what I would do is maybe show you what I use, the supplies that I have here at home, and it might give some of you a better idea who are newbies in the area of needing to be catheterized either in the doctor's office or at home. First of all, I know a lot of people have said, I've read a lot of people who have said that their doctor's offices use those very long red rubber catheters, and how much they hurt. And that doesn't surprise me that it would hurt. I don't know an IC patient who could tolerate one of those unless it was a very small size. But generally speaking, if you're going to a standard urologist who also sees male patients, they don't generally carry small size catheters because of the men they see, and they don't see a lot of women, generally speaking. And I can understand why those big, long, red rubber catheters would be unpleasant for most people. My doctor doesn't use them on any of his IC patients, and I don't use them at home. So what I thought I would do is show you kind of a little bit of what I use, what my doctor uses, and how it's made things much easier for me to learn how to self-catheterize and know what to ask for when I'm in the doctor's office. I'm lucky. My doctor's office just is prepared. They just have a standard operating procedure. If it's an IC patient, this is the catheter that they use. They never have to go get a smaller size for their patients. This is what they use. So I'm lucky in that regard. And I've been going to my doctor for 12 years now, and so his staff knows me. His nurses know what I need, and they have it all ready and prepared. I show up in the office, and there's an installation prepared because they just assume I want one, which I do. Here's what I use. First of all, just to self-catheterize. If you have retention like I do, and you need to catheterize yourself at home, these are the catheters. You can see how they're only 6 inches in length, and there's what they look like on the back. They're made by Mentor. This is what's known as an intermittent catheter, and I usually I buy them by the box, actually usually by the case, because I use that many. I don't use anything larger than a 10 French. That's the measurement of the circumference around that the catheter is. Now this is a straight tip catheter where if you don't need to do an installation, and all you need to do is catheterize yourself to empty your bladder, you can use one like this that has a straight tip. This tip at this end is pointy, and that's the part that would be going into your urethra, and then the straight opening down there is what would be going into either a collection container or the toilet. Like I said, nothing bigger than a 10 French for me, sometimes an 8, but you can go all the way down to pediatric sizes, all the way to 5s, 6s, and 7s. So if you have urethra pain, small size matters in this case. And for most IC patients, the smaller the better. So if your doctor doesn't have anything smaller than a 14 French, if it were me, I wouldn't allow them to catheterize me. I would ask them to please order something smaller and reschedule the appointment for whatever it was they were going to do that required you to be catheterized, if it was an installation or whatever. Never let a doctor or a nurse put a catheter in you if you don't know what size it is. That is one of the first lessons that I think people who are new to it need to know. You have the right to know, you have the right to ask, and before they do anything, you need to understand what they're going to do. So the first question, if you're going to be catheterized, is what size are you using? If they tell you it's a 16 French, or a 14 French even, I'd be like, no way. That's going to hurt me. I already have urethra pain. Many of us already know before we've ever been catheterized that we have urethra pain, and that being catheterized is likely something that may be irritating, and definitely if it's too large a catheter, then it's highly likely that it will be painful and uncomfortable, and you'll never want to have it done again. Now, the other catheter that you can use if you're doing installations yourself at home are the same thing, except you'll see that it has a funnel tip on the end. And that's where you attach the 60 milliliter, let's turn this around. This is a 60 milliliter syringe. Some people don't need them to be 60 milliliters because their installations don't have that much liquid in them. Mine did. My cocktail consisted of enough ingredients to pretty much fill this 60 milliliter catheter. I'm going to peel this open for you and then show it to you up close and personal. So this is your 60 milliliter syringe that I write about frequently, basically 2 ounces in American measurements. And this is what when you finish mixing your cocktail in your sterile specimen cup that you need to have, this is what you'll use. If you're going to do installations at home, you will purchase sterile specimen cups, and you will mix the cocktail in here, and then once the cocktail is ready, you will remove the cap off the 60 milliliter syringe, or if you have a 40 milliliter, whatever the size is. Most of us tend to use 60 milliliter. You can get smaller, but And then what you do is you put this, you unscrew, you will have had this unscrewed. You have mixed the cocktail in between each ingredient. I always just would loosely set the top on as I prepared the next ingredient, but then you will take the lid off, you will put the syringe in, and you will pull back on the plunger until all the liquid is filled in the plunger. Then what you do is, I usually cap it and set it aside, because then I need to prepare to catheterize myself. So then what I do is lidocaine gel. This is my lifesaver. Not only do I use it for catheterizing, but I use it for my vulvodynia, my urethra pain. I use it for a multitude of issues. I love lidocaine gel. Some people can't tolerate it, I know. Some people love it like me. I couldn't live without it. And my doctor has written the prescription so that I get 2 of these boxes at the same time. And it's wonderful. I use 2%. You can get 5%. 2% works fine for me. But when I'm getting ready to do a catheterization, you take out the tube, obviously. Here you go. Your wonderful handy-dandy tube of lidocaine gel. I love it. The nice thing about it is that they also come with these lovely handy-dandy little things that you can put on the end as you go through the gel. You know, like with the toothpaste thing, you can roll it up so that you get every little ounce out of the tube that you possibly can. And since you're paying for them, like me, you want to squeeze out every last ounce of it. And so I get that out, and then I open the catheter, and this is if you're going to be doing an installation. And here's a better look at the funnel tip catheter. This part goes in your bladder, and this is what is at the outside. So you catheterize. So then you put a blob. I usually have this spread out on the counter in my bathroom on a clean, fresh paper towel, and I have the catheter laying on the counter on the paper, and I'm wearing rubber gloves. And then what I do is I put a blob of lidocaine gel on the tip, and then sort of roll it around to make sure that a good portion of the tip is covered in lidocaine gel. So I want to make sure that there's a good amount on there so that it assures painless and easy insertion into my urethra. So I prepare that, and as soon as that's ready, then I catheterize myself and drain my bladder. So this is the end that the urine is coming out of into either, like I said, a collection container or the toilet. I've gotten good enough that I can do this where I insert it partially into my urethra. I turn the catheter up, cover it with my thumb. It's not all the way in at this point, so no urine should be coming out. And again, I have rubber gloves on, or latex gloves. And then as soon as I sit down on the toilet, I let it drop down this way and let it drain right into the toilet. And then while sitting on the toilet, I take my installation cocktail, pull the top off, and you connect it like this so that it's got a good tight connection, and this is still in your bladder. And then you slowly, you don't have to do it too slowly, but you don't want to blow out the catheter either, so you slowly push the cocktail till it's in your bladder. Now, once it's in your bladder, don't pull it apart, because if you do, the catheter, if it's still in your bladder and you pull the syringe off, everything that's in your bladder is just going to come draining right back out. So you have to pull the whole thing out of your bladder all at once, and then your cocktail will stay in place. So that's how you do it if you're going to be doing an installation. Now, if you're just going to be doing, if you're just going to be catheterizing because you need to, you suffer from retention like I do, and all you want to do is drain your bladder, this is the intermittent catheter. It doesn't have a funnel tip, and again, this is the tip. You want to make sure you get coated in lidocaine gel. If you can't tolerate lidocaine gel, there are sterile lubricants that you can use that would be sufficient for making insertion more comfortable. I like lidocaine gel. I love it numbs everything up. I like it going into my urethra. It helps relieve the urethra pain that I already have, makes insertion smooth and simple. It just glides right in place, as well as having some anesthetic effect. So you slide this in, and again, this is the end that's coming out that's draining into your collection container or your toilet. So that's the kind of catheters that you should be using, or your doctor's office should be using. So if you're new to this, I just thought this might be a good little how-to lesson that I could, because I see a lot of postings about this, and I thought maybe a few people would like to see what it is that I'm trying to describe when I write about this online. It's a little more difficult to imagine. And every one of these items, with the exception, the lidocaine gel requires a prescription, so that your doctor does need to prescribe. Every insurance I've ever had, it's always been my cheapest and lowest copay. I've never had to pay a lot of money to get it. So everybody's insurance is different, so, if you want to try it, find out first what level of coverage you have for it before you go filling it, and find out maybe you have a lousy, crappy copay. But for me, it's just a generic item, and every insurance I've ever had has covered it at the lowest copay possible. So if you want to try it, I find it really works great for my vulvodynia, my vulvar vaginal pain, and my urethra pain. I often put a big blob of it on a cotton ball, and I just, spread the skin, push the cotton ball with the blob of lidocaine gel on it right up against my urethra, and your skin will close right around the cotton ball, and I leave it there. Sometimes I'll go back in 20 minutes and do a second one if I'm really suffering. Sometimes one application works. And I do that for my urethra pain. I find it really helpful. I also put it on cotton squares, big blobs of it, and then we'll just slather it up and down the whole vulvar vaginal area, and put a panty liner in, and go relax. Put a heating pad on, and I find it very, very helpful. So, side down again. Sorry. So, again, something worth looking into if you have vulvar vaginal pain, vulvodynia, urethra pain. This can be a good tool in your kit to be able to do for yourself without having to go all the way to the doctors to get some help. So that's a good thing to know. People are just always writing about catheters and how painful it is, and I know that there are some people that just can't do it, no matter how small. Some people have really, their urethras have really closed up, and there's just no way. But there's a lot of patients out there who could be helped by instillations if you had the right one, or being able to self-catheterize at home if, like me, you suffer from retention. It's not something you should be intimidated by. It's really very simple. I use a big standing magnifying makeup mirror to visualize the urethra. I don't do it blind because you should never reuse these. It's one and done. Same with all of these items. If you're doing cocked installations at home, you never, ever, ever reuse or wash any of these things. You use them once and you throw them away. The other thing about these three items is you do not need a prescription for them. So if you are thinking about doing installations at home, and your doctor's agreeable to teaching you how to do that, these three items, do not ever buy them from a pharmacy like your corner Walgreens or CVS or any place like that. They have to order them special. They will cost you a fortune. I have bought all of these items by searching the internet for the best price possible. And if you're doing it on a regular basis, as I was, I needed to have a sufficient quantity on hand because I was doing them daily, basically. And I would order enough that I got free shipping. So the catheters, the sterile specimen cups, and the 60 milliliter syringes, none of those require a prescription, and you can shop for those online. Google them. This is Mentor catheter, so you can Google those. These are BD, Becton Dickinson, 60 milliliter syringes. You can Google that. And you can just Google sterile specimen cups, and you'll get a lot of, different replies to that as well. Like I said, latex gloves are my friend. You can see I'm almost out. I go through them by the hundreds. I prefer latex powder-free exam gloves. Some people like the powder. I don't. Some people are allergic, obviously, and they need vinyl. I'm luckily not allergic to latex, and I can use latex gloves and don't need vinyl because I prefer them. And so I buy large boxes of these at a time. It's usually cheaper than 2 smaller boxes. And so those are all the supplies that I have on hand at my house at all times if I need to do any of the things, either administer an installation or I self-catheterize every day, at least 2 to 3 times a day because of my severe retention. And there's been so many posts on the ICA Facebook page of late about people talking about learning how to self-catheterize or being catheterized in the doctor's office, having it be an unpleasant experience. And it doesn't have to be. While I realize that many of us do suffer from urethra pain, and we could live our lives never knowing how to do this and be perfectly happy. I would have been perfectly happy never to know how to use a catheter in my life. I could have gone on and lived a very happy life. But I will tell you that if you learn how to do it, if you have the right size and the right tools and can get comfortable doing it, you can have a tool at your disposal that you can use at home without having to go to the doctor for help. A lot of us have retention issues and, could benefit from catheterizing maybe a couple times a day, even just before. I always do one before bedtime. It makes a huge difference in my sleep because my bladder is empty when I go to bed and it takes a lot longer for it to fill. So it really has impacted my ability to get a decent night's sleep. So, and the same thing with installations. If you like them and you find that you're getting benefit from them, but it doesn't last long enough, then talking to your doctor about learning how to do it at home is something that you might want to think about. It's not that hard once you learn how to do it. There are a lot of pieces to the puzzle, and that could be a whole other conversation I could have another time on how to learn how to get that done and get that accomplished, because it's a little, it can be a process. You have to talk to a lot of, your insurance, and it can be a process. But I will tell you that if you like bladder installations, you benefit from them, but you feel as though, dragging down to the doctor's office once or even twice a week is a real chore, and it doesn't last long enough for you, and you wish you could do them more. You can do them more if you have a good doctor like I do. My doctor allowed me to do them every single day, 2 to 3 times a day, and I love them. So right now I'm getting them done at the doctor's office because we're trying to fight off some infections I've been getting, and he's started adding an antibiotic directly into the cocktail. So for the time being, I have to do them at the doctor's office. So I'm going twice a week right now. But I just had one done today. I feel wonderful. My bladder feels wonderful. And it's been over 3 hours, and I haven't had to void because of the relief from the installation. So anyway, I thought I'd share that with you. People were constantly writing about a bad experience with being catheterized in the doctor's office, or what do I get if I'm going to do this at home. And I thought this might be useful information for anybody who is wanting to try it or is even nervous about getting their first cocktail, say, at the doctor's office. Don't ever be afraid to speak up. Don't ever be afraid to tell a doctor that catheter is too big and it's going to hurt me and it's not acceptable. I need a smaller catheter. If they don't have any in the office, then say, I'm happy to reschedule my appointment for another day until you can order a smaller size that will be more comfortable for me. If they're a decent doctor, that won't bother them. So I hope this was helpful. Feel free to message me or post on my blog or Facebook me if you have any questions about what I've talked about today. I hope some of you found this helpful, and maybe in the future I'll do something about installations more, or we can always talk further about this topic. But I thought I hope you all liked it and that you got something out of it. Thanks a lot. Talk to you later.